We're going to encounter pain, physical pain in our life. We cannot stop it, but we can change our reaction to it. And that's what's really, really important.
From Weill Cornell Medicine in New York City, this is Your Brain with Dr. Phil Stieg. Internationally renowned scientist and researcher, Dr. Stieg is neurosurgeon-in-chief of New York Presbyterian Weill Cornell Medical Center. This week, Dr. Stieg and his guest explore easing pain with mindfulness.
Today, I have with me Dr. Sara Lazar. She is a scientist in the Department of Psychiatry at the Massachusetts General Hospital and Harvard Medical School. She studies the beneficial effects of mindfulness training and its positive impact on controlling fear and pain. She will describe how her personal life experiences led to this line of research and its benefits. Sara, thank you for being with me and welcome.
Thanks for having me.
So let's start off with the what. What are we talking about line? What is mindfulness and what does it do?
So mindfulness is really simple. It's just paying attention in the present moment in this non-judging, open, and accepting way. So anyone can do it anytime. Mindfulness meditation is just practicing it continuously for 40 minutes. And you might think, well, okay, what's the difference? Well, think of it sort of like, playing soccer, right? Anyone can kick a ball, right? It's simple. It's no big deal. But in order to make that amazing goal, you need to practice. And so the idea is that we practice for 40 minutes every day so that we can be mindful throughout the day in the game of life. So that when we're driving in the horrible morning commute traffic or just dealing with the morning commute, dealing with the deadlines and dealing with the difficult people in our lives, we can remain calm and centered and mindful at all times, not just while we're sitting and practicing.
So how is that different than meditation and yoga?
Often when people think meditation, they think mantra. There's no mantra here. But people like to usually focus on breathing sensations or sounds. And so the idea would be you just become mindfully aware of breathing sensations. So how do you know you're breathing? What's the actual sensation of your rib cage expanding and contracting? And your belly rising and falling? The air passing through your nostrils? So that's all you're doing. So you just pay attention to that for 40 minutes. And that's the meditation.
For a person just starting doing this and they want to think about their heart rate to focus their mind, what does it do for them? What are they going to notice physiologically, emotionally, or in their day-to-day life?
It varies tremendously from person to person. So during meditation, this can be a bit of a trap. A lot of people say, oh, I can't get my mind to stop. And, I'm restless and I can't do this. And that's okay, because everyone, even really advanced meditators, have days where their mind is restless and they can't do it and. So it really does take practice. But with practice, what happens is that people say that they start to be calmer and less reactive. You start to actually be more aware of what's going on around you during the day. When you're outside walking, can you just be aware of walking? What are the sensations of your feet on the ground? What's the sensation of the sunlight on your face? What's the temperature? What's the wind? Rather than thinking about whatever's in your mind, just focus on the sensory experience. And so initially you have to put some effort into this, but with practice it starts just happening naturally, and just really just take in nature for a few minutes and just let go of all the stuff that we worry about. People also report better memory, increases in sustained attention, increases in creativity. It really has really wide-ranging effects.
When I started training to do mindfulness, I couldn't get my mind to stop.
Yeah.
For obvious reasons. And so what my instructor made me do was lay down. And I lay down and eventually I fell asleep, which she said was okay. It's progress of letting things go. Even for those individuals that have a hard time letting go, I just want to hold it out there that there is hope for you. And then the other thing that you said is 40 minutes. I don't have 40 minutes. I personally think that if I can do, 10 to 20 in the morning, and if I can get it in the evening, I'm feeling pretty good about it. Is that your sense as well?
Definitely, yes. There have definitely been studies with people where they're told just to do 10, 15, 20 minutes, and there's benefits. So if you go to a meditation center, they're going to tell you 40 minutes, but in the clinical settings, they usually say 5, 10 minutes. And there's some apps, and the apps often have 10, 15, 20-minute guided meditations. So definitely, you can definitely benefit from the shorter periods.
So I found it interesting, which will lead us into some of the research that you're doing, is how you actually got into mindfulness. Can you describe that to us, please?
Yeah, so back in grad school, a friend and I decided to run the Boston Marathon. Yeah, but we ramped up too quickly and I destroyed my knee and my lower back. So I went to see a physical therapist and they said, stop running and just stretch. And so as I was leaving the physical therapist's office, I happened to notice an ad for a vigorous yoga class that promised to promote cardiovascular fitness and strength and flexibility. So I thought, great, this will be a way I can just stretch, but stay in shape and still run the marathon. And this is back 25 years ago now. Back then, yoga and meditation, were equivalent to tinfoil hats and, crystals and whatnot. I went to this purely as a form of physical therapy, right? I had zero interest whatsoever in yoga or meditation, Eastern philosophy, any of that. But the amazing thing was after 2 or 3 classes, I started noticing I was more relaxed and I was interacting with people in a whole new way. And it was really profound to me. And so I decided when I finished my PhD to switch. And I've been doing this research ever since. And I did not run the marathon. Everyone always asks me that. It's like, no, I never did run the marathon. Stuck with yoga.
So that kind of gets into the things you're really focusing on, the sense of how mindfulness can play a role in the management of pain and managing the fear of pain.
There's 2 components to pain. The one component of pain is the actual physical sensations. So the burning, stabbing, tingling, that sensation of it. The second component is the emotional reaction to it. I don't like it. Make it stop. Why me? And what's really interesting is that those are in 2 completely separate parts of the brain. And they're unrelated. So you could take 100 people and apply the exact same physical thing to them, a shock or you hitting them or cutting them or something like that. And all of them on a scale of 1 to 10 report the intensity of the physical sensation probably about the same. But in terms of the emotional component of it, it would be all over the place, right? Because there's just no correlation between the intensity and the emotional reaction to it. Because some people are very, stoic or just, very not reactive. Other people are even the tiniest little, bump and they're, in tears. We did 2 studies, one with pain, one with fear conditioning. And so the first one was with the pain. And what we saw was that the meditators, when they were meditating, the actual sensory cortex that was actually experiencing it increased while they were being mindful of the pain compared to just being in a normal state. But their I don't like it, make it stop went down. And that part of the brain also went down. And so this gets back to, okay, well, what is mindfulness? Mindfulness is paying attention to the present moment sensory experience in this non-judging way. And that's exactly what they were doing. They were paying attention to the pain in this non-judging, open way. We're going to encounter pain, physical pain in our life. We cannot stop it. But we can change our reaction to it. And that's what's really, really important.
I think you said that with mindfulness, you were able to reduce the perception of pain by 22% and the anxiety related to pain by 29%.
Well, right. So it was just the reaction to the pain. The actual pain, the sensory cortex did not change. It actually went up, right? And also the reports of the pain, did not change. The first pass, it might look like stoicism, but then when you talk to them and then you and you understand what the mindfulness is about, you understand, no, it's about being open to it. And so that's why they were saying, okay, yeah, I'm getting shocked, but it's okay. It's not bothering me.
So tell us about what you were doing to induce pain. I think people need to understand.
Oh, sorry. Yeah.
Real.
So it was a very mild electric shock, sort of similar to like, the hand buzzers, like where, you shake someone's hand and it buzzes you. So it's about that intensity of pain of a mild electric shock while they're in the MRI scanner, but they didn't know when it was going to come. So they were just lying there and all of a sudden they get shocked. They knew it was going to happen, but they didn't know exactly when it was going to happen.
And you didn't have any trouble getting any subjects to do that for you?
Yeah, we pay them.
We'll return to our discussion with Dr. Sara Lazar after this short break.
There's a lot of things you can do with a smartphone. Check the latest headlines, shop online, post embarrassing pictures to your social media feed, and many other forms of stress and distraction. And now, you can also meditate. Here's how.
Begin by taking a comfortable position. Hold your back nice and tall, taking a posture that allows the breath.
This is the voice of Tamara Levitt, a superstar in the world of meditation apps for your phone.
We'll learn ways to soften our reactivity and practice techniques like noting and pausing. We'll also explore the
Levitt holds the title of Director of Mindfulness at a company appropriately called Calm. She is, in a way, the Taylor Swift of the meditation app world. She has written and performed hundreds of guided meditations for the Calm app, supervising every aspect of the recording and editing process.
That's part of why it's so useful in alleviating anxiety.
One of the best-known apps is Headspace, a name reminiscent of the groovy, new age 1960s.
There's something about taking a slow train across the country that is fundamentally satisfying. While the train isn't an express, it's showing no sign of delay. It's just chugging slowly and inevitably through the landscape.
Headspace promises to take you on a trip with hundreds of guided meditations, mini meditations, sleep sounds, and even SOS meditations for emergencies.
You're free to relax, enjoy the passing scenery without any sense that there's something else that requires your attention. That to-do list is just going to have to wait.
The last app in our little survey goes by the highly utilitarian name of Insight Timer. More than just a clock, Insight Timer boasts of a catalog of more than 80,000 different guided meditations, some led by Hollywood celebrities like Goldie Hawn, and this novel take on meditation by British comedian Russell Brand.
This is Russell Brand speaking to you on this app directed at creating serenity, assuaging fear, motivating and soothing. Now, if you're disturbed by the sound of my children in the background, imagine how I feel. You can press pause or turn this off at any moment. And one of the things you discover as a parent is that you can't press pause on your children, and I've contemplated whether or not there's a humane and moral way to press pause on a child, and as yet I've not discovered one. You know what to do, sit comfortable.
As Mr. Brand meditates on the elements of good parenting, we'll bring this brief exploration of the world of meditation apps to a close. Links to the apps discussed in this segment can be found in the show notes of this episode and on our website.
There are benefits to mindfulness. You've seen structural changes in the brain. What areas of the brain benefit from mindfulness, and what kind of changes you see?
There are these 8-week clinical programs that are completely secular. You learn how to do mindfulness, and you're told to go home and practice it every day for 40 minutes. We scanned people before and after one of these 8-week programs. And we also compared their brains to people who were scanned 8 weeks apart, but who didn't do anything in between. And what we found was that there were 5 major brain changes. The most interesting one was the amygdala. And so the amygdala is often referred to as the fight or flight part of the brain. So it's involved in emotion regulation, regulates cortisol and some of the other stress hormones. And what we found is that decreases in stress correlated with decreases in the amygdala size. And this is really cool because in animal studies, you see the exact opposite. So that was really cool. And then there was 3 regions that work together, which are the hippocampus, the posterior cingulate, and the temporal parietal junction. And what's interesting is that those 3 regions together contribute to something called the default mode network. And so a lot of people have heard about this. It's the when you're walking down the street, not thinking about anything in particular, or lying in the scanner, not thinking about anything in particular, this is the network that comes up. And the idea is that this is the network that's thinking about me. What am I doing today? And what happened to me yesterday? And what do I have to do tomorrow? It's been shown that this network gets turned off when you meditate. And also, but the connections between these nodes of this network get stronger. So we think what's happening is that this change in structure reflects increased connectivity between these three regions and also the turning off of it. So they're getting stronger and they're better able to turn it off while you're meditating. And so therefore you're not thinking about yesterday and tomorrow and all the other things, and you're able to just quiet your mind and focus on the present moment.
So it's a little bit like when you're using your cell phone and you look at your connection to the internet and you've got 1 bar. With mindfulness, you can increase that consistently to 5 bars, right?
Exactly.
And basically, you're just improving the connectivity between different regions of the brain that allow you to function more effectively. And your specific questions were in relation to pain and the fear response related to that, correct?
Right. Well, that's first study where we're looking at structure. That was actually just stress. So people going through the stress reduction program.
Okay.
The pain study was with long-term meditators. And then we also did then a study with fear conditioning, which again was 8 weeks before and after, right? So what is fear conditioning? So good old Pavlov, the dogs see the food, hear the bell, they learn to salivate when they hear the bell. What fear conditioning is so the same stimuli we used with the pain, so that, there's a mild electric shock, and we paired it with different colored lights. So we do that, and then we just show them the lights and they don't get shocked. And then we bring them back the next day and we say, okay, how well do you remember that either you're going to get shocked or you're not going to get shocked? And what we see is the meditators remember correctly more than compared to the exercise group. And so it's really clear the memory of being shocked and then not being shocked, that was better preserved in the mindfulness practitioners compared to the exercise stress reduction. Again, that's the whole reason for practicing, right? We practice so that when we encounter pain and stress and, life, we can better bring up the mindfulness.
So is there an age dependence of this? Do you know? I mean, if old people pick it up, is it going to be as beneficial if I picked it up when I was 22?
We don't know that. We're actually just finishing up a study now with people 65 to 80, and they definitely benefit. And so, I can't tell you that it's as beneficial as if you did it in your teens, but they definitely benefited.
Is mindfulness also useful with children?
Yeah, there's been several studies now with young children, both high school students, but also even grade school students. I think like 2nd and 3rd grade, and showing that it's definitely beneficial. And they like it. They really enjoy it. Some teachers are now incorporating it, especially like right after recess when the kids are all running around. It's sort of a nice way to sort of transition from recess into the classroom and sort of gets them into the present moment so then they can focus.
In our spine center, a lot of patients come in with low back pain.
Yeah.
And they don't have a surgical or an injectable lesion that they would benefit from. So we send them for cognitive behavioral therapy. And that has been shown to be beneficial. They feel the pain, they just develop an alternate way of thinking about it. What's going on there? What are they doing?
Yeah, no, definitely it's part of it. Definitely mindfulness is great for pain. But it's not just thinking about the pain, it's experiencing the pain differently. Oftentimes, when people have chronic pain, you automatically start to tense up around it. You hold that part of your body differently, and and this is part of the fear. It's like, oh, if I move this way, I'm going to feel more pain, right? And so you don't go out and do things because, it's going to cause me more pain. Again, it's the fear of pain. And so that's really what the mindfulness is. It's like, okay, well, can you be okay even if you're feeling pain?
When you quantified it in your papers, is it that awareness of it that gets reduced around 30%?
The actual experience of pain does not go down. They report like a little bit, but that's actually not significant. It's just the suffering. It's the I don't like it, make it stuff. That's what goes down. And then there's been other studies with chronic pain patients. And what they show is that it's the fear of pain, and it's called pain catastrophizing. Also, lots of times what people say is, at the beginning, it's like, I am my pain, this, my painful knee. And at the end, it's like, no, there's me, and then there's this pain, and the pain is not part of me. I am separate from my pain. And it's a really important distinction.
With that distinction, am I able to continue on with my daily life and do the things that I want to do?
Yes. And that's the idea. Part of it is because, you tend to clench up if you're in pain. And so if you relax, you actually experience less pain because you're not all tensed up. And so if you learn to just relax around it, it completely changes the experience of the pain.
So where are you going with this? What's going to win you the Nobel Prize?
Well, we'll see. So we've just finished the study with the healthy aging. And so we're hoping to do more with that and to ask that question that you asked. Is there an optimal age? How old can people be and still benefit from this practice? Can we get people who in their 90s, can they still benefit from this practice? What other benefits are there? Also trying to really dig more down into what's actually happening in the brain. We now know where the brain is changing. So now I'm trying to dig deeper into saying, okay, so what exactly is happening in that part of the brain?
Looking back on your career, which is, we'll say, not even half over, what was your biggest surprise?
What was my biggest surprise? I guess, the first time, seeing the brains change in just 8 weeks. I saw a paper about juggling, and they showed that the brain changed after 3 months of juggling. And I was like, wow, could that really happen with meditation too? And lo and behold, it did. So I knew the brain was changing, but I didn't know if I could actually detect it in just 8 weeks.
Yeah, I mean, I find the whole concept of plasticity in the brain to be absolutely amazing. I mean, I'm a little bit older than you. And when we started, we were taught that you were born with what you had and you better make the best of it. And now we're learning, and you're proving with your studies that the brain can adapt to different environments and you can train it. And that's what's the most important part in my mind of your message is, it's like a healthy heart, there's the healthy brain. There are things you can do for it.
Yeah, definitely. Definitely.
Dr. Sara Lazar, you've given us all hope in dealing with the anxiety related to pain and a little bit of understanding of how that really works in our brain. I want to thank you so much for taking the time to be with us today.
Thanks for having me.
This is Your Brain with Dr. Phil Steeg was produced for the Weill Cornell Medicine Department of Neurosurgery by the Really Interesting Picture Company. The episode producer was Hildy Rubin. Social media management by Jillian Jean Creative. The series is directed and edited by Tom Veltri, with music by Lenny Williams. The announcer is Mindy Weisberger. Interstitial by Allison Power. For more information, visit our website at thisisyourbrain.com. If you enjoyed this episode, be sure to leave a review on Apple Podcasts, and be sure to follow Dr. Steeg on Facebook at This Is Your Brain.